Hello, nurses, staff, and anyone else attending. My name is Darren, and Nabil asked me to share an experience that I had while I was nursing in my final year at Mount Royal. Now, this was in my final focus, and this experience was probably the most difficult experience I had while nursing in my career so far. Now, just to give you some background, I came on shift on my unit. I was assigned 4 patients, and I began my assessments for that day. Now, the first patient I came to, he had, when I came on, he had been restrained the night before. He had a nasal gastric tube put in, and he was attempting to pull it out, so they restrained him. And this man, he was going to be having surgery on the day of my shift because he had outpouching in his esophagus that was occluding his airway. Now, what happened on shift was interesting. I came on, he was respiring at 74, his O2 was 74%. And so I immediately put him on oxygen, assessed his respiratory status, and noted he didn't have any use of accessory muscles, he didn't have any visible signs of difficulty breathing. His perfusion was doing well. And so after putting on oxygen, put him up to 4 liters from 3 liters that he was already on, he recovered up to around 77, 78. And I consulted my preceptor, let her know that he wasn't doing well this morning, and she advised me to give him his nebulizer. So I gave him his nebulizer. I sat him up in bed because he was having a little bit of congestion. And then I monitored him for a few minutes, and then I went off and came back about 5-10 minutes later. And when I came back, I noticed that his oxygen mask, the cold nebulizer that I had given him, had been removed. Now, I assumed at this point, this is where things started going wrong. I assumed my preceptor had seen this patient. So I went and found my preceptor and asked him how the patient was doing, thinking that she had removed his nebulizer. And she told me that the patient was good. I didn't know this at the time, but what she meant by good was that the patient looked like he was doing good or doing better. And this assumption that I made was incorrect. She did not see the patient. She didn't assess him. And so I carried on with my day, assuming that the patient had recovered. He was no longer showing any congestion like he had with me having set him up. And I was prepping him for surgery that morning. And I went for my break at 10 o'clock, and then I was called in about 15 minutes later telling me that my patient had passed away. I returned to the unit, and what happened was there was a group of doctors around, and they were asking me what had happened, what were the details of the passing, what was the latest oxygen saturation. I turned to my preceptor asking her the latest oxygen saturation, and she turned to me, and we both had thought that the other person had assessed the patient and had declared the patient doing fine, but in fact the patient wasn't, even though we saw that there was no signs of distress. Now, the hard part for me was I had to contact the family and let them know, and we couldn't get a hold of them for the longest time. But when they came in, we met with the family, myself, my preceptor, the doctor, to let them know the conditions of the passing, to let them know that there was error on my part and the part of my preceptor with our communication. We had miscommunicated about the oxygen saturation, and because the patient didn't have signs of respiratory distress, we weren't alerted to conduct further action because we both had assumed that the patient had recovered from an acute episode, and that we were dealing with the chronic issue of the outpouching of the esophagus, prepping for surgery when the patient had passed. This was a difficult conversation that I had with the family, but it went well, and the patient's family accepted our apology. Now, I consulted with my manager, told her the situation, filled her in, as well as filled in my faculty mentor, and that was difficult, again, to continue to talk about the errors that we had made and feeling as a nurse that I had dropped the ball, so to speak. I did things right. I did assess the patient's respiratory status. I did set the patient up, put them on oxygen, gave them some salbutamol, the cold neb, but I did not reassess the oxygen saturation. And this was a mistake. Looking back on, it's a mistake that probably many people could make with miscommunicating. I learned out later on, because the manager had filed a complaint against the doctor. We had gone in cold after the situation and talked with the family, myself being very emotional, my preceptor as well. And I learned later that we looked very guilty, like we had committed a serious offense in this case, which set us up for a lawsuit as well as further repercussions from the family. Now, I didn't know that in the situation that we had rights. We had the opportunity to have management or somebody from Karn or somebody to sit in with us as a representative to work as a third party and address the family so that we could have time to recover. As well as I didn't know that I had time to get my own feelings together, to discuss with the doctor, to come in with a unified plan. What had happened was the doctor had called us in without any time to hear us declare to her what we had done, the interventions, and the detailed plan of the morning. And so then it kind of felt like a little bit of blaming. Now, because the manager had gone to bat with us and complained about how the way that things had happened, she came back, the doctor came back and sat down with us and apologized about the way that things had happened and disclosed errors that she had made in her career and events where she had been sued because of misjudgments she had made or mistakes that she had made or things that she had missed, and letting us know that these are things that happen to everyone. Everyone has opportunities to learn from experiences like this, because these experiences can happen to anyone. No matter your preparation, if you get busy or you get distracted or there's a miscommunication, things can get missed in the clinical setting. And this disclosure helped me come to terms with what I had done. And it had helped me to further reflect on what I had done in my care and see where I'd done well and see where I had room for improvement, as well as it showed me that there is a team available on the nursing unit. There's management, there's representatives from our registered body that will speak on our behalf in situations where we need it. As well, it showed me that nurses and doctors can work as a team. I believe Nabila is talking today about how it's difficult to transition from students to full-time practice, and there are bumps along the way. And I was glad in this instance where I had support that were able to help me to get through this crisis, to debrief, to make sure my charting was accurate, to show that I was a nurse that was worthy of working in the nursing profession, even though I had made a mistake. And I encourage you all to seek out the support that you need when you integrate into practice. And I thank you for this opportunity to share my experience. And if you have any questions, you are free to contact me. And enjoy the rest of Nabil's presentation.